From your own experiences, do you go to the doctor?
No. I'm just be honest. And every time I've gone, they always give me bad news and a bill. So
Yeah.
Bad news and a bill. Bad news and a bill.
And you got to pay for parking.
Coming in, flex. I just wanna win, LABB, who we running with, 2, 2, 3, 3, I'm on 10 again, station.
Welcome to Coming in Hot, Health Opinions and Truths, where we talk about the challenges that are facing our community. Today, we have some amazing guests to talk about why we don't go to the doctor. Lottie, take it away.
my name's Lottie Olambami. I'm the senior manager at the Bristol Myers Squibb Global Health Equity Platform.
Hello, everyone. Ramona Barres. I am a mother, I am a patient, and I'm also head of global patient engagement at Takeda.
What's up, everyone? Matthew McCurdy. Co-founder of Black Health.
And I'm your host, Melody Noreen Blackwell. President and founder of Color of Crohn's and Chronic Illness. Now, I know all of you are kind of familiar with the fact that it took me about 30 years to get a diagnosis of Crohn's disease. And it wasn't due to not going to the doctor. For years, I was able to go to doctors, I took care of my preventative health, and my mom stayed on top of that. But it still caused so much detriment to me because it should have never taken 30 years to get diagnosed. From your own experiences, do you go to the doctor?
No. I'm just be honest. And every time I've gone, they always give me bad news and a bill. So
Bad news and a bill. Bad news and a bill.
And you got to pay for parking, right? But yeah, my experience as a patient too, I've always put the needs of others in front of my own. So whether it was my kids, my husband, everyone else was more important. So for me, that was the biggest issue.
I actually like going to the doctor. I feel like it's an opportunity and a space just designed for me. And so I like to take advantage of the expertise, and I would like to be well. So I feel like the doctor is a good space for me.
But was that from your upbringing, though? Did you, as you're an adult now, you're navigating life on your own, did you come up with this system of, hey, I'm going to start taking ownership of this, or did you learn this as a child?
Yeah, I learned it as a child. I think I remember going to the doctor's office regularly. My parents taking me. I think Kaiser was our insurance, so we were blessed enough to have insurance. And yeah, walking into the doctor's office, going into this sterile environment, but I never felt that I was going to be harmed or that something was going to happen wrong. I didn't pay that bill at that time, so maybe that has a lot to do with it. But we did go to the doctor regularly, and then when we were sick, we had a great family physician as well. And so probably just being comfortable in that environment helped.
I was going to say that.
And being familiar. And I know other people don't have that experience.
And maybe your parents instilling that in you, right? Because I think sometimes we inherit the trauma that some of our family members have encountered in the medical space. So like if your parent had a horrible experience, or your grandparents, sometimes we bring that influence into our space. Because I know for me, it was fun sometimes, but it was always a hassle. And I felt like, it was always inconvenient. So I think maybe as a child, I internalized that, and I just, replicated that as I moved into adulthood.
And I think she said... Yeah, go
ahead.
No, I think she said something that's really important, the hassle, right? And it depends on the context and where you live. So if you live in the city, as you mentioned, parking, right? The added expense of paying for parking to go see the doctor.
Right.
Or if you live in a rural neighborhood, how far is the doctor from you? And all these things come into play when you're talking about how often do we go to the doctor, such as myself, which is never.
I also think that going to the doctor in and of itself, it's you have to block out so much time. So it's not like I'm just going to the doctor. It's not going to McDonald's to get a sandwich or going somewhere. You're there. You make you pay for the transaction, and then you're out. You get there. The delays then you're going to get bad news, you're going to get a bill. I think a lot of people feel a lot of internal trauma that they don't even know how to put voice to. This is why I don't go. It's like, I just don't have the time, but it's, they don't want to navigate through all those pieces that involve going to the doctor.
And there's a family component. You know, I know my family, if you're sick, if you're not bleeding or on the deathbed, it's ginger ale and sleep.
Right.
You know,
Right.
yeah. So, and you know, what are we teaching our kids?
Right.
What environment are we brought up in terms of when should we actually seek healthcare?
So Lottie, did you have a bad experience when you were younger?
Not so much when I was younger, but when I was older and I had to go get physicals for sports, and I would go to the doctor, and it always seemed, and this is not all doctors by it, but this could carry some of the stigma. You have one bad interaction with one doctor and it kind of carries on to the rest of them. When I would say that something was bothering me, they would say, oh, that's normal. I play basketball a lot. When my knee, they would say, hey, that's normal. Well, that's not kind of what I want to hear. And, I think being able to empathize with somebody who's concerned about that and not kind of waving that off of, oh, that's normal. That, so I tend not to go because of that reason.
Yeah, we know that, for a lot of Black people, they experience doctors not believing their pain, not hearing them when they say they're feeling something. And so, yeah, that makes a lot of sense. And I think that would cause someone not to go.
And that's why I encourage our communities to date your doctors, right? Just like how we swipe on the apps for partners in life. Do the same with your doctor. Like if it's not a good fit, if the relationship isn't working well, if that person isn't listening to you, shop around. We have options.
Right.
Yeah, I was in a meeting last weekend, and a physician told me that you can fire your doctor, right? You feel free, if they're not giving you what you want, to fire that person. Now, there's a lot of stress, as in dating, meeting another doctor for the first time, or trying to find that right person. But you can leverage referrals or people that who have a good physician.
But there is that small barrier when we just casually say, fire your doctor. There's a sort of authority figure where you don't want to push back on the doctor and saying, no, I want you to take this seriously, when he says, no, that's, there's that authority figure that you're like, okay, you know what, maybe I'll just take my problems and go. And I think we need to overcome that burden.
Yep.
Well, I think that also starts to cause us to minimize our challenges.
Yes.
And then we're now in a space where minimizing has actually caused us more detriment, because it was an issue. There was something going on. I could have had some kind of tear, or there could have been a cartilage issue when the doctor said, oh, that pain is just normal. So when we get to that place, we're now in the ER because it's an emergency. It's no longer something that we could have managed earlier on.
Yeah. And that's why these conversations are important, because we need to know, like, when you start feeling symptoms for that knee, did you go to Google it first? Did you talk to your wife about it first? Do you have a primary care physician or clinician that you see, or did you go to the ER or urgent care? Because I think all that kind of plays into where we need to put the resources in, training our providers, providing more access, having doctor's offices open outside of just those 9 to 5 typical hours. This is where we start to get some solutions if we allow people to talk about their own journeys and we kind of map it out. I mean, you're the data person, but I think that's key to continue these conversations and empower, our communities to share what their journeys were.
And I agree with that. How do we empower ourselves to be our best advocates? And sometimes we are, right? And we're all advocates. We advocate for I advocate for my parents ferociously, but do I do that same thing for myself?
Right, parents or children.
Yeah.
Because parents will advocate for their kids, and they'll advocate for their parents, leaving themselves to deteriorate, and their health continues to decline. So we're speaking from actually this lens of where we are and what we face. But if we dial it back historically, having access to healthcare, I think it was you, Lottie, that said, you don't go unless it's an emergency. That's because it was just a bill. Everyone didn't have access to health insurance, and ACA has definitely expanded opportunities there, but there's still challenges for people, even when they have health insurance, of saying, I'm not gonna go because of what has happened historically. You only go when it's an emergency. How do we combat that fear?
Is it fear or is it reality, right? Is it someone's true lived experience.
Right.
And we could talk about being resilient. We could talk about bringing an advocate with you to your appointments. But I know I was trying to get my weight loss drug, approved by my insurance, and they said no, right? And I'm like, I'm chunky. Give me my weight loss drug. So, there's barriers on top of barriers, right? These systems. But I love what you're saying. But I think it could be so many different paths that we can, take to help this be a better experience for patients, for people. I don't know.
Yeah, I think stigma exists for a reason, right? The reality is that for a long time, our hospitals, our doctors' offices have been a place of trauma for our communities, right? And so I don't think that we should ignore that, but sort of naming that and building solutions to help our community get past that is important. There's a number of different things that people have been doing for that, and that's having more Black physicians, which is not an easy thing to do, right? There's years of training, takes time, it takes money, but also, preparing materials to help our community be a bit more health literate. We're providing opportunities to empower themselves in that space. But I think it's important to note that, there are historical traumas and current traumas that have happened to Black people, and those experiences are really real and valid.
I also think actually right now, it's an exciting time because there's different platforms where, we talked about the burden of how much time it takes to go see the doctor.
Yes.
Well, now you can actually make an appointment through Zoom.
Yes.
And I think this is opening up a different avenue for patients,
For sure.
where I may feel more comfortable in the house talking to my doctor, and I might be able to advocate better when I feel comfortable, or I have, you're in my house now. So you take some of that power back. So I do think it's an exciting time, and how can we leverage these systems better for patients?
I also, to piggyback off what you're saying, believe that now there's a more defined lens on health education and health educators. So people are finding a lot more value in people and hearing their stories and understanding their experiences and saying, okay, I've learned from this and I value that more than what my physician said to me, because you've lived it, Lottie, or you've lived it, Ramona, and Ramona said that this is what happened and I can relate to that. And I want to ask Ramona the question.
Communication.
And social media has opened up this other world for people to connect with people and trust more people outside of the white coat, which if you've dealt with different levels of trauma, you're not going to the doctor, but you'll go search in Google, like you said, Dr. Google, but you're also looking for these people that you can connect with and trust, because they've created some pathway of trustworthiness by sharing their story and being vulnerable.
I love that you say that, really, because we're taking healthcare and we're elevating it, beyond science. And there's an art to this, right? There's skills. There's the communications. There are different ways of, sharing information, social media, radio, print newspaper, but word of mouth.
Yep.
How much information did we talk about during COVID? Like when we were like, okay, well, did you get that? Did you do this?
Yes.
We can continue, what we experience in that space and really make it that sustainable model.
Yep.
Because, you empower people. I learn something new every day. I'm a lifelong learner, student, right? But the more that we talk, the more that we introduce different methodologies, but not just the typical, I'm the doctor, I'm the professional, I'm going to talk to you and I'm going to tell you and you're just going to sit here and listen. No, let's have this bi-directional sharing of information. Let's have some humility and humanistic approach to how we're engaging with patients in the healthcare system is key.
And I think there is a double-edged sword with that, with engaging with people, having more access to people, because you have people who are saying things that are just completely false.
That too.
You just have people who are saying things that are just completely false. But you can't, and I think over the last 2 years, you can't just wave your hand at those people and say, hey, what you're saying is nonsense, listen to me.
Right.
Why are these people connecting with that message?
Right.
Because they've developed a relationship. And I think sometimes doctors don't look, if you develop a relationship with your patients, you are more likely to get that patient to listen to what you're saying.
Yes. Yes, I think the relationship is so transactional, though. I come here, I look at this when it comes to patients and providers, but people need the transition. There's an issue with my knee. How do I get better? Not just, oh, that's normal. This is just what happens. It's growing pains. Take a moment and say, you know what? This is normally what occurs at this age due to this. Give me the opportunity to be educated so I can respect that you cared for me. It really, to me, it comes down to, do you really care, or are you just checking the box because I know you're getting paid for this appointment by my insurance company?
And I think people really care, but I think, we need to change the systems. We have all these different things in place that are kind of bucking this humanistic approach to, you know, how we deliver health. You know, it's 15 minutes that you're with the doctor. You know, you walk in, the receptionist, the MA, the medical assistant comes in, takes your labs, the nurse comes
Receptionist with a bad attitude.
with a bad attitude.
Don't they always?
Always.
And so I was just having this conversation the other
They're
day.
not paid enough though.
That maybe we need our clinicians to have some role reversals. You know how it's like be a CEO for a day or whatever that
Yes,
show was?
yes.
You know, let the physicians be a receptionist for a day.
Undercover
so you
boss.
understand why by the time I come to you, I got an attitude because
Yes.
she told me I had, you know, a $400 bill.
Right.
And I have insurance, right? Like those are some of the issues that we encounter before we sit before you and have
Right.
conversation.
Right.
You know?
You know what? I was actually talking to a few friends of mine, and I did agree with this, that every time they go to the doctor, they're always waiting, right? If their appointment is at 9 o'clock, they don't see the doctor till
Yes.
9:30. However, on the doctor's note, it says, if you're 15 minutes late, we'll charge you and we'll reschedule you.
Yes.
And I'm saying, well, there's a discrepancy here, right?
Is that a power dynamic?
Yeah,
Yes,
why is your
power
time more
dynamic.
valuable than mine? If my appointment says 9, I would like to be seen at 9:05, not 9:30. You know what I mean?
It's because that 8:30 appointment got there at 9:15.
Yes. Yes.
Ooh,
I get it. I
But
get it.
maybe we should start charging them when they're late. Maybe
I
we
would
should
love that.
say, you are 30 minutes late. Put some respect
So
on our name.
you get a credit on your bill?
Yes.
Or
give me a
you waive
credit.
my next copay at least,
Yes.
or at least acknowledge
Yep.
that,
Yes.
you know.
Yeah.
Well, some don't even
Acknowledgement.
acknowledge. They're
Yeah.
just like, hey, you know, glad you're here. I'm not. By the time
Yes.
you get to me, I have high blood pressure because I've been waiting for an hour and a
Yeah.
half.
Yeah.
I have a question. We were talking about sort of circles of trust for health information and healthcare. Those of you who I think we all work in sort of a health tangential field. Do you find that you're that person of trusted health information for your circles? And how are you sort of distributing information and ensuring that people
Ooh,
get the right
That's a
information?
good question. So I'm a pharmacist, and we're the most trusted healthcare provider. You know, every year it's like us or nurses. Which one is it? But I grew up as a clinician in the era when HIV was at its highest. And I was a better pharmacist when I took the time to listen to my patients, to talk about, you know, hear their side effects, hear about that they had a lack of housing, and that's why they weren't taking their medicine, and that's why their viral load wasn't, you know, in place. But it was because I touched them more frequently than their physician. So I touched them like pretty much every month, if not more. But it forced that trusting relationship to be built. And then it allowed me to be in a position where I can go back to their physician or someone and say, hey, you know, Miss Jones is complaining about this, or this is why she hasn't been taking her meds. This is why she's showing up late for an appointment. So don't be mad
Right.
that she had to take 2 buses and a train
Yep.
and the weather's bad.
Yes.
So from my direct clinician experience, I leveraged that trust that I have with my patients to help them navigate the system and help them have better outcomes.
Yeah, I mean, I couldn't say anything more than that, but you know, I'm a clinical pharmacist as well, so I definitely agree with everything she said. But amongst my friends, I would definitely say I'm the go-to when you know anything happens. They'll send, hey, what is this medication for? Should I be taking it? You know, what are some of the side effects? And you know, I feel comfortable giving that information. And then sometimes I have to tell them that doesn't make any sense. You know what I mean? Or you know, when they say I'm, you know, hesitant about, you know, a vaccine, it's, that doesn't make any sense. Or, hey, I think I'm healthy. It's like, actually, that's serious symptoms. I think you really need to go see a provider. Well, I'm talking to you. What, you know,
Well, tell me about my weight loss drug that I can't get. Why I can't get my... Should I get that one?
Like, why am I just finding out that you're a pharmacist?
Because we coming in hot.
because we coming in hot. You coming in hot.
Wow. Okay, you learned something new every day. Like, I thought we were building these bridges, and like you just never said that.
I'm a tease. I can't let you
Okay.
get
Okay, you
everything.
can't give me
We're the most
everything.
humble professionals.
Yeah, exactly.
You know, we don't call
Sneaky
ourselves
brag.
doctor.
Yeah.
You know, we have
I
doctorates.
call you
You know,
doctors because you are doctors, right? And yes, I think that it's interesting because I run a health organization, but anything that anyone has that pertains to their gut or their butt, I'm getting pictures. I'm getting messages. I'm getting calls. And I'm like, I run a health organization, but here's what I would do. Here's the information that I have. And I find myself really using the information that I have to help with my community. But you two touched on something as you were sharing your journeys of supporting. Do you think that knowing too much actually puts you in the position or makes you less inclined to actually pursue your health care the way you should because you have all this information? Because yes, I subscribe to Dr. Ginger Ale all day long. I love it. But I just, knowing that you're both clinical pharmacists, I'm like, oh, wait a minute. Maybe this is a product
Is this
of
a therapy
also knowing
session?
too
What is
much.
this?
Right.
Like,
You know what?
The truth or what's your...
I would say my wife would tell me I'm too stubborn. And I'm telling her, well, I know when it's time to go. But then she'll say, well, you know, recently I had like a MRSA infection. Like it was bad.
What's MRSA? Tell people.
Oh, yes. Come on.
It's a methicillin-resistant staph infection.
Okay.
Right?
And what do people say if they have MRSA? They say it's MRSA, right?
MRSA, they call it MRSA. Okay, yeah. So MRSA, and I got it. I don't even know how I got it, but it was like big. It was like really big, and she was like worried. She was like, "Look, it's not getting better." I just didn't want to go because I said, "Look, I know what it is." I had some
Did you
medicine.
put some Vicks on it?
Yes.
I had some ginger ale. I tapped ginger ale on it. No, I tapped ginger ale and did this.
You did all that.
I definitely did, but I took some medications because I knew I knew how to treat it. I was all right. Look, I had some lying antibiotics in the house. I took some antibiotics. After she was like, look, after a week, if it doesn't go away, you're gonna go to the doctor. Okay.
Right. Yeah.
That week that didn't go away. 2 weeks I didn't go, and it's this. I think I know what's best, but even me, I need to go see the doctor. I went to the doctor, and he said, "Yeah, you're right. You're treating it the correct way." It went away after that, but that only confirmed my suspicion that I didn't need to go in the first place.
Now I think you're never going to go to the doctor because of that.
You know everything. Oh my gosh.
But no, we're infallible too. I just think some people in healthcare, they just, they want to self-treat, and sometimes that's that is an issue.
Okay, I guess my story is very similar to the physician in Indiana. I wish I knew her name, who passed away from COVID, and she didn't have the best experience.
I don't want your story to be similar to hers.
No, but it's real. Like, so her story was highlighted as it should be, because it just shows that there are so many barriers about how we show up, who we present as, that dictate the level of care, how nice people are.
Yes.
And so, to be honest, I've had some of those same traumatizing experiences, and that I know kind of keeps me from like, okay, do I need to go on there? Because they, sometimes they don't listen. But do I need to walk in and say I have all these degrees, I have this insurance, to make sure that I receive good care or good service? So for me, that can be exhaustive, and I think that may be one of the realest reasons why I don't go.
I don't think any of us want to posture ourselves. Like, you don't want to come in being like, I'm this, I'm that. I recently saw my chart that it said founder of color of Crohn's and chronic illness. And I'm like, no, why is that in my chart?
They were like, watch out.
She knows what she's talking about.
Right. So it kind of made me feel like, oh man, this is now tied to everything I do. Yeah. Does that mean that I'm going to get treated a certain way and I'm not going to really understand the engagement of my community? I started this because we're all the same and we still are the same. But being able to have these accolades or these titles or lenses where people see that they should treat you better. I want to be treated the same way as I'm a person. We're all
you do that
people.
anyway, because you give people the privilege of your experience and what you've learned. So thank you for what you do every day. So who cares if it's in your chart?
Yeah,
and I'd say as well, like, it being in your chart and maybe you getting a premium experience also helps you communicate to other people what they should be receiving, right? And so that level of expectation is now higher because I should be getting this diagnostic, I should be getting this, access to this therapy or this treatment, and so now you can communicate to other people like, hey, this is what you should be expecting. These are things that you should ask for when you go into the doctor's office.
Do know that everybody don't read the charts too,
right? So. And I'm fortunate. I have great physicians, so I'm fortunate now. I didn't always have that. So the experience of
dating,
me even going through my journey, I was subjected to step therapy. And so step therapy for you all know, but step therapy is a process where you're giving the lowest medication in that space. The cheapest.
Not the lowest, sometimes the cheapest, but pretty much a starting point. Yes.
The lowest and the cheapest.
Okay.
Well, what do you have against step therapy?
So what I have against step therapy is I had aggressive, severe disease. I had 8 fistula. I had drains in my colon. I lost my hair. I couldn't walk. I was starting to have a lot of vision issues. I had mouth ulcers. I had urgency, arthritis, like probably 20 other things that I can't remember right now. But I was going through this space of step therapy, being given pills when we knew that pills had no efficacy for the level and complication of my disease. There was no, I should have went straight to a biologic therapy for the disease that I have. And that wasn't my journey. I'm grateful for that journey because I never knew that that's what I was going through. But it goes back to, how do you know? Like, where are we supposed to really get this understanding of navigating healthcare? We talked, Matthew, you said you went through as a child. I, as a child, also went through the process of understanding that there are preventative health appointments. There are certain shots that you should get at certain ages, and you should have this consistency and yearly physicals. But for people that say, well, you only go in an emergency, that becomes a lifestyle because that's what's taught. So where do you learn it if you don't learn it at home? Where are the opportunities to learn how to navigate this crazy lexicon of healthcare?
I think great organizations like Coachy, right?
Yes.
For sure. But how do you find them if you don't even know you're looking for them?
No, I think that's a great question. And I think that's part of the broader discussion that we're having here. How do we advocate for ourselves? How do we even know that we should be advocating for ourselves? And where do we go to find that information? I don't have all the solutions, and I think that's why we're here to discuss how do we get there, and how do we move patients closer to where we want to be.
And I, going back to the step therapy, so clinically, there's a reason why we do step therapy, because we want to start with the most, studied drug regimen where we know the side effects to see if that can maintain before you start to go to some of the more complicated regimens that come with like additional risk and things. Now, the thing is, your clinician, partner, whether it's an MD, nurse practitioner, whomever, should be checking in with you to say, hey, how's this therapy doing? But there's a reason why. Like, if you think about blood pressure, the guidelines probably change, but you start with a water pill, right? Because they want to see if you pee, does that make your blood pressure regulate? So there's a reason why those are in place from a clinical perspective. But back to that relationship, like your doctor, your provider should be with you in that journey to see, okay, is this not working? Let's go to this. So it should be a workup approach versus a top down.
Totally understand that. And I think that there are a lot of circumstances that it can work for.
Yes.
But when someone is at that stage of severity, knowing that it took 30 years almost for them to be diagnosed, and now they've had multiple surgeries due to this, that's not the step they should enter on.
No. So your experience is not step therapy at all. And it goes back to the dating and finding the right partner who's going to be your clinician partner. So you can have that fair exchange of, this ain't working, homie. Or I'm taking too many pills. I'm missing doses, whatever it is. But that relationship is key.
I guess this segment should be called Dating Your Doctor, right?
Yes, dating your doctor. Listen, swag and surf through them. Just be like, no, wrong step. Keep it going.
You tried it.
Right.
We're all looking at you.
I don't have anything.
I'm like, Matthew, you're in a space where you are having a lot of touch points in cancer.
Yep.
And that is a space where, it's near and dear to me because the pathway that IBD has to it. But our community, when they are diagnosed, they're either labeled not adherent because they're not well, or they're going to, and they don't show up to all of their appointments. And it's not even that they're non-adherent. What did you just say? Miss Lady took a train, 2 buses to get to the appointment. She got there late. Now they won't see her. But you can't just not see somebody when they're going through chronic illness that is temperamental, that these therapies could progress you or worsen you. What are you hearing in the community about these challenges?
Yeah, I mean, I think, one, if you don't have a relationship with a physician, with a team of physicians, ideally, right? It shouldn't just be one person. You should have a team that can advocate for you. They don't know your context, right? We all come to the hospital, the doctor's office with a different context, whether it's lack of transportation or, my community suffers from food insecurity. And without that understanding, your physician is going to try to diagnose you, give you a prescription or whatever have you. But there's not a fix for sort of the underlying causes of disease, right? And so we, as a public health organization, Black Health, are really focused on how do we improve communities And how do we help communities know the things that are happening around them that may have an impact on their health outcomes? And so what we hear a lot is that, hey, I didn't know that not having access to food is why we see a large number of people have diabetes or in long-term heart issues, right? Or I didn't know that due to the pollution at the plant down the street, that's why everybody has cancer, right? And so, teaching people about those factors when it comes to our structures and the environment on health has been really important. And then empowering them to say, these are your politicians in your area who you can write to, who you should fire if they're not doing what they should be doing, so that you all can advocate for the things that are going to be better for your community. So it's really about, taking this conversation about health, and I know this episode is really focused on doctors, but it's really about community and environmental health and the things that have an impact on our ability to be healthy.
We need to elevate public health. We shouldn't just talk about public health in the setting of a pandemic, or if we're talking about sexually transmitted diseases, right? That's the only time I feel like I hear about public health. But if we're thinking about health equity, it's public health, right? Because health equity is a basic human right. And we know that, me as a patient, only probably about 20% of me, or me as a person, 20% of me is Ramona, the patient, but you got all this other 80% of me that's potentially influencing how I show up or what my outcomes are as a patient. And we take those, for granted, but they're really real. And they're so evident in colorectal cancer and so many spaces where you see these differences in mortality, morbidity within our community.
And I think there's been more discussion on a more holistic approach to how we treat patients. I've seen a lot of discussions about health equity and social determinants of health that really encompasses so many more factors. Where does a patient live, right? What food do they have access to? What schools do they go to? There's a lot of data out there that tells us that, minority patients are more likely to be diagnosed later and staged at a much, more aggressive staging in cancer. And that's why we see some of these outcomes that we see in disparities. And just getting back to kind of the original topic, why aren't we advocating for our patients? Why aren't we going to the doctor, right? For someone to be stage 3, had they had no symptoms up until this point? Right.
I think it goes back to, I'm for sure it goes back to dismissive behaviors, like, this is par for the course. I think this is normal, but also our family dynamics of not knowing that this is something that needs immediate attention. We like a lot of times we get community members with digestive issues. They're diagnosed later, but they share, for 3 years I ignored this and this and that. But my story is what I started having rectal bleeding at 13 years old. And we went to the doctor. We didn't ignore it. But we have community members that may have started and they didn't want to tell their parents or they were ashamed. I remember the doctor asking my mom if I was sexually active. So no one really wants to go through that because I wasn't sexually active. But you're asking my mother that instead of qualifying me and taking me through a diagnostic journey, that the symptoms were showing that I probably
taking that extra step. Like stop making assumptions.
Yes. And that can prevent someone from going over the hurdle. Now, you know, Matthew, because we're part of this, and also you run it, well, you too now, Lottie, that we do these community conversation tours where we're going back to HBCUs because we believe that getting information and understanding and education about health is multi-generational. And if we can manage the information delivery to get it to people that are at early stage adulting, they're now empowered because they're hungry for just control and their own like security. They're going to go out and start sharing it. And I believe that is a huge aspect of opportunity for cutting things off in a space of disparity, because they're now being equipped with tools that they would have just listened to a physician and kept it moving with their life, but they'll hear these little like triggers and say, wait, I remember Lottie saying that when he came to my school. I remember Ramona saying that, or Matthew. I'm going to pay attention. I just recently got a message, this was on Monday, from a young woman who shared her whole story about seeing a college tour last year and asking, can she connect with us because she wants to impact colon cancer, because her mom died 4 years ago from colon cancer and she was diagnosed 2 years ago with Crohn's disease.
Yeah.
So
But look at the domino effect that you're
Yes.
having just with reaching out to students on a college campus. So, okay, we empower them with information so that maybe they move through their health journey differently. But she was likely a caregiver for her
Yes.
mother.
Yes.
So now that knowledge is spilling over there, then maybe she's in college. Maybe she wants to go into the health
Yes.
professions, right? Because so often people just know doctor, nurse, sometimes they know pharmacist, but public health, getting a PhD, being a researcher, who knows how you may change that young lady's life as well as whomever you touch just by this one event that you had. I mean, kudos to you.
But I think pharmacy, sorry, Lottie, but I think pharmacy, you all have changed. Because I remember being a kid and watching, like, going to People's Drugstore. We said, I was a little dating myself, People's Drugstore. Went to People's Drugstore, would fill the prescription, and the pharmacist would just fill the prescription. And that's what my conceptualization was of a pharmacist. They fill the medicine. Then I started to notice, ask a pharmacist. So I would see the signs, and I have seen the progression. I get calls from pharmacists now. Do you want to talk to the pharmacist? Do you have a concern about this? So the relationship has evolved because the trust is there with you all, pharmacists, more than it is with the physician too. Because we feel, as a patient, I feel like you're more human than the doctor. You're not just there to check off, okay, prescribe this, here's 15 seconds, 15 minutes, 15 seconds. And then I'm off to the next person. But the pharmacist, if you see them every week, how you doing, Mr. Lottie? Yeah, how's your kids? I know you brought, it's that whole like cheers of medicine.
That rapport. And I think especially with pharmacies in particular, there are a lot more pharmacies compared to hospitals,
Yes.
right? And
Yes.
you have access to a lot more pharmacists than you do your doctor, right? And I think
Yes.
companies are starting to understand that, and you'll start seeing that, certain companies, rolling out this platform. So now you've seen CVS with the mini
Yes,
clinics,
yes.
because they're trying to get that engagement and
Yes.
engage patients differently and utilize nurse practitioners and
Yes.
pharmacists in, a lot more, innovative way.
Because when I was little, I thought the pharmacist was just a cashier, even as a pharmacist, right?
It makes sense.
And the reason I became a pharmacist is because I was working at Walgreens as a cashier, and I was trying to go to med school, but I kept having too many kids. And this pharmacist was like, "Girl, you need to work back in the pharmacy." I'm like, "What's that?" And hence I became one. But
Yes.
I mean, I love that narrative. And that's the value of us being present in our communities as well too. So formats like this, going to the colleges, even if you are that pharmacist in the retail pharmacy down aisle 9, you're important. You matter. You never know the impact, or the life-saving information that you may provide to a patient or to someone you encounter. So I'm just so thankful to be part of this today. But Melody, look.
And you know what? And I do want to say kudos to these college fairs that you have,
Yeah.
because it really talks about kind of cultural competency. How are we showing up and delivering information to patients and populations in different ways?
What's
They're-
cultural competency?
Yeah, what is that?
What is that?
What is that?
What is that?
Because
Nice
I'm going to hit back on you. Go ahead, give me the definition.
Nice little segue. So no, cultural competency is just really recognizing, understanding that different patients come from different backgrounds, right? And understanding the nuance in that. Right. And I think it shows up in what Coachy does, how you're going to HBCUs to give information. You're not just sending out a flyer and doing a webinar.
Right.
Who are you going to engage with
Right.
that?
Mhm.
Right.
Right.
You're having interactive events. You're having conversations like this that'll go out to, millions of people
Right.
for them to listen to. And I think we have to be innovative in the way that we engage communities, especially communities that are disproportionately, represented in things like clinical trials or going to the doctors. Right. How are we doing that? And especially with younger patients, right? How are we utilizing Instagram and TikTok that they can't stop watching?
Yes. We have to be, I think, conscious of inviting them and then giving them something to talk about.
Yeah, empowering. Yep.
Right. Because if we invite them to something, how are we really advancing them? We're not if we don't give them something that they can sink their teeth in. And that's what a lot of these webinars are doing. They're rolling and playing in the background of people living their lives. So there's never a real connection that creates transition to something better.
Yeah, and I think it's really important. I think what you do well is that you bring it to them, but bring it to them in a way that's accessible and that's fun. You leverage music, you leverage culture, right? I think health is so sterile and boring, quite frankly, right? And health fairs are tired, but bringing health to someone and providing an opportunity to have fun, incentivizing it a little bit with a game or a gift card is really important too. But then, once they're there, right?
Yes.
You can grab them, you can give them that information. And to hear stories about people messaging you saying, hey, this is what happened to my family. This is what's currently happening to me. How do I get involved? How do I be an advocate?
Yes.
Right? Is what I really hear, and that I think is really encouraging. And when we do them, we have to say, all right, we got to go, right?
Yes.
Students want to talk to us
When does that happen?
for hours and
When
hours
does that ever
afterwards, because I think they're just really excited by the energy. And so, they're really fun to do and I think really informative.
There's a reason why some people are activists and a lot of people aren't. That some people are advocates and I think a lot of people aren't, because we don't often know what the starting point is. Our college tours, I believe they're giving people a real starting point. And that changes the game, not for them, but for their families and their legacies. And we can see this shift happening, that people are thirsty for information, but they don't know where to go, or they're listening to, like Lottie said, to the most unreliable resource.
Matt will come in and clean them up. Yeah.
So this is but Grandma Gertrude said, if you do this and you jump 3 times.
But the power of the voice in the community, right?
Yes.
And families. We got to lean into it. We got to respect that. And that's why I do like cultural competence. I do like cultural intelligence. But again, if we just boil it down to just recognize me as a person.
Yes.
Because that simplifies it. Sometimes when, providers or companies hear cultural intelligence or competence, they get scared. It gets overwhelming.
Yes.
So to your point, just starting authentically. And, if we misstep, if we misspeak, then we apologize, right? Because we're just human.
Yes.
But bringing that element back in. But again, those parties, I wish I can attend everyone at the HBCUs because it feels like Coachella. I'm like, ooh, I'm Beyonce. But we're talking about
dance,
health.
We sing. It's a good time.
And we're talking about health.
Yep.
Yes. And what's been interesting about the tours is that they'll come for the purpose of getting the food or the gifts or whatever it is that we're showing in support of them, but they stay and then they start to share with their friends. And now their influence in their community, that's what we want people to do, is serve their communities.
Yeah.
And they're serving their sphere of people and giving them this information that we brought to them, that how else would they have ever attained it?
Yeah.
This has been a really awesome conversation. We are so tremendously grateful to be in partnership with all of you. And because of what you all bring to us, we're able to bring it to others. Before we wrap up this episode, I'd love to hear some final thoughts about Lottie going to the doctor and, us progressing our community in relationships with physicians.
So I think ginger ale will always be a healthy staple in my, we'll be the gold standard, but definitely going to try to, be my own advocate and, do what I preach.
Yes.
And I think, we're glad to be here and work with a great partner like yourself.
Yeah. I mean, this has been great conversation. So I'm putting a plug out there for all the schools, all the universities, HBCUs and non-HBCUs. Invite Koshi to your campus. You will be so surprised by the impact that it'll have on your students, whether it's in their day-to-day lives or their future careers.
Yeah, I think health and well-being is community driven. We have to educate ourselves, educate our peers on what's important, what's actually factual, and then spread that information, continue to be advocates.
All right, you heard it from them. Thank you so much for checking us out. Stay tuned for more discussions on health coming in hot. Health opinions and truths.
Running through it with the young influence, adolescent presence, I'm succumbing to it. I've been giving yeses when I shouldn't do it. I complete ejected, but the moves elusive and I'm barely moving, but I'm still gon' boost them. I can't work on winnings when I know you're losing, so I with the winnings and they throw the deuces. Guess I had to pivot, shooting numbers.